Hello, my name's Paige Williams with the University of Charleston, and today I will be presenting to you a condition known as sinusitis. So, sinusitis is something that most people watching this video have most likely had at one point in their life or another. It's very common. So, on my presentation here, we go over to what is sinusitis. So, sinusitis is just simply inflammation of the sinus cavity, which can be presented as a lot of different signs and symptoms. So here I've provided a picture of the sinuses. Over here on this side we have the healthy sinuses, which they look really pink. There's not any excess drainage in here. And then over on the side of sinusitis we have tissue lining of the sinuses that is very inflamed and red, as you can see in this picture. And also there is a lot of drainage, which patients will most likely complain about when they come in with sinusitis. And you can see that in the picture. So there are two different types of sinusitis, one being bacterial and one being fungal. And the treatment that the provider will decide on based upon what kind of sinusitis the patient has is really determined by which type of sinusitis they have. There are a lot of different causes of sinusitis. So the first one we'll start with is a deviated septum. And I have provided a picture of what a deviated septum is. It's just the septum that, runs down the nose, and if it's pushed off to the side, that can cause some inflammation in the sinus cavity and ultimately lead to sinusitis. Another cause of sinusitis is enlarged turbinates, which are passages made of bone and soft tissues in the nose. And I have included the picture that shows the inferior, middle, and superior turbinates that are inflamed, which will cause sinusitis. Another cause of sinusitis is allergies, which is the most common cause. Another cause of sinusitis is sinonasal tumors, which are just tumors that grow in these sinus cavities. They can be either malignant or benign, but that can cause sinusitis. And then we have nasal polyps, which I've also included a picture of. These are just benign growths that occur in the sinus cavities, which can cause a lot of inflammation and lead to discomfort for the patient and ultimately sinusitis. So, clinical manifestations of sinusitis. First, we have the objective symptoms, or the objective manifestations. These are thick yellow or green post-nasal discharge. So that's what the patients would most likely complain of, having a lot of mucus or drainage. Secondly, we have a fever. And third, we have swelling around the eyes, cheeks, or nose. And that's just from the inflammation that's built up in their sinuses. Then we have the subjective manifestations, which is difficulty breathing through the nose. And this is just because of all the inflammation that's in there, or it could be because of the drainage that they're having, and it just makes it really hard for them to breathe in and out of their nose. So usually they'll be breathing through their mouth. Also, throbbing facial pain, and as you'll notice, this is pain that's located in the same areas that there was swelling in around the eyes, cheeks, nose. So they could have a lot of pain in those areas. It could be really tender to the touch. And also down here we have a headache, which is it goes along with the throbbing facial pain as well. So for diagnostics of sinusitis, we have, most of the time, the provider will be able to diagnose the patient with sinusitis based solely on the symptoms that they are experiencing. They won't really need any kind of tests or anything to determine exactly that it's sinusitis. They can also obtain a culture of the drainage that the patient is experiencing and send that off to the lab to determine what kind of bacteria is growing in it, if any. And we have the nasal endoscopy, which is usually only used if patients have had a lot of sinus infections or sinusitis episodes. So this is where they do a scoping of the nasal passages, and I've actually provided a video that shows what sinusitis looks like through an endoscopy. So here's that video.
Endoscopic exam looking in the right side of the nose, and you can see a lot of boggy, swollen nasal tissue with some green pus streaming from the area of the maxillary sinus, which is in the cheek. In the back of the nose, you can see a lot of clear white pus and mucus accumulating in the nasopharynx. When the patient speaks, you can see their soft palate elevating here. As seen in this video, one of the symptoms of sinusitis is thick, foul nasal drainage.
So there's that nasal drainage that I spoke of. Next, we have the treatment for sinusitis. So one recommendation is to drink a lot of water. This is to thin out that drainage that the patient is experiencing and to keep them hydrated well. Nasal sprays, which can be just a regular saline spray that you can get over the counter, or corticosteroids, which can be prescription or over the counter like Flonase. Antibiotics, which this is also up to the provider if they feel the sinusitis will resolve on its own. That may be what the provider decides for the patient, but they can write antibiotics if it's a severe case. Decongestants, which will open the patient's sinus cavities up and help them breathe a lot better. Home remedies, which is to elevate the head when laying in bed and apply a warm compress to the area, which will also help with the facial pain and tenderness that the patient may be experiencing. So complications that can arise from having sinusitis are vision problems, meningitis, chronic sinusitis, which is a pretty common one, mental confusion, especially in older patients, osteomyelitis, which is where the inflammation of the sinus and infection actually gets into the patient's bones, or cellulitis, which is where the inflammation or infection gets into the patient's skin. These are rare, but they can happen. So for prevention of sinusitis, especially for people who have had multiple episodes, we want to make sure that they are practicing these prevention methods, as they're very important to ensure that the patient does not continue getting this sinusitis. So one of them is to avoid cigarette smoke. It's very irritating to the patient's sinuses, and if at all possible, we would like for them to steer clear of cigarette smoke, especially in children. Avoid polluted air. This goes along with the same concept of the cigarette smoke. Same thing. It's very irritating to the patient's sinuses. Hand washing. This is just to ensure that you don't get any bacteria or infection that can worsen or cause a worse sinusitis flare-up. Next, we want to manage allergies. This can be done by over-the-counter medications like cetirizine or just any over-the-counter or prescription medication for their allergies. And also use a humidifier. This will ensure that the air that the patient is breathing in is very moist. It will keep their sinus cavities very wet and open. This goes along the same lines of avoiding the cigarette smoke and avoiding polluted air. You just want to make sure your air is really clean, really moist, and hopefully this will prevent future flare-ups of sinusitis. So there's my presentation on sinusitis. I hope you enjoyed, and I hope you learned a lot. Thank you.